Hello, folks, and welcome back to my podcast entitled Suboxone Out the Monster. This is episode number 7. I'm your host, Don Horner, or Dr. Don. Again, the purpose of the podcast is to get you to stop opioids and transition to Suboxone. But first, I have to read the old medical disclaimer. All content and information provided in this podcast is for informational and educational purposes only and does not constitute medical, nursing, or other healthcare advice, diagnosis, or treatment. Always seek the advice of your physician, pharmacist, or other qualified healthcare provider with any questions that you might have regarding a medical condition or treatment. And never take any medication that is not prescribed by your medical provider and filled by your pharmacist. No street drugs, no dealers. Remember, there's a lot of fentanyl out there, and the fentanyl will kill you. I just love saying that. So far, I've only talked about the good things of Suboxone and buprenorphine. So let's talk about the bad things. To digress a bit, I love Clint Eastwood, the actor, especially with his spaghetti western movies. Now, they were called spaghetti western movies because they were produced, directed, and casted mostly by Italians. You remember Clint Eastwood mowing down dozens of badass banditos with a single 6-shot Colt revolver without reloading. It was a miracle. Movies like A Fistful of Dollars and For a Few Dollars More, and my favorite, The Good, the Bad, and the Ugly. Like this movie, most drugs have a good and have a bad, and so it is with Suboxone and buprenorphine. In the previous episodes of the podcast, I have extolled and praised the virtues of Suboxone and buprenorphine. But there can be some risks. Number one, dependency. Suboxone contains buprenorphine, which is an opioid, and like other opioids, it can be addictive. Now, buprenorphine is a Schedule III opioid and therefore less addictive than the more addictive Schedule II opioids such as oxycodone, oxymorphone, methadone, and fentanyl. Even so, Suboxone can lead to physical dependence, which can make it difficult and challenging to stop Suboxone. Side effects include constipation, nausea and vomiting, dizziness, sweating, and fatigue. Overdose, while Suboxone is a safe alternative to other opioids, it is still possible to overdose on Suboxone, especially when taken with other medications that depress the central nervous system, such as benzodiazepines, which include Xanax, Klonopin, Valium, Ativan, just to name a few. They just make you sleepy. Cost. Suboxone is expensive, especially the film strips. Generic Suboxone has been around for several years, which helps with the price. Taste. My patients tell me that Suboxone tastes like crap when it dissolves in the mouth. Advantage goes to film strips, which dissolve in about 30 seconds as opposed to Suboxone tablets, which take about 5 minutes to dissolve. The liver. Suboxone poses a low risk of damage to the liver when taken as prescribed. It is recommended that liver function tests be checked before Suboxone is started and periodically during the treatment program. Now, I always recommend to my patients that they obtain liver function tests annually as part of their blood metabolic profile. And lastly, the ugly. The Food and Drug Administration, FDA, warns of dental problems have been reported with medicines containing buprenorphine when dissolved in the mouth. Problems include tooth decay, cavities, oral infections, and loss of teeth. One of my patients reported loss of tooth enamel, that's the hard covering of the teeth. To reduce the risk of dental problems, after the medication is completely dissolved, rinse the mouth with a large amount of water and swallow. The bottom line is that the benefits of Suboxone and buprenorphine to treat opioid use disorder clearly outweigh the risk and is an important tool in the treatment of opioid dependency. In the next segment, I will interview another guest who has made the journey from opioids to Suboxone. In the words of the Nike commercial, the ones who make sporting good equipment and shoes, just do it. Just do it. Thank you. One. Hello, ladies and gentlemen, and let me introduce my next guest, Kelly. Kelly's been my patient for a long time. She's a wonderful woman and has a wonderful family. Kelly, how are you today?
I'm doing well. How are you?
Good, 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 good. A little bit hot out there today.
A little bit.
I know. Kelly, the purpose of the podcast is to convince people to get off of opioids and onto Suboxone. Kelly,
Yes.
How old are you? How old are you now?
I'm 43.
43. How old were you when you first started opioids?
I was 26.
26. Now, when you first started, was it for recreation or was it because of an injury or surgery or what was it? What was the circumstances?
It was surgery.
Surgery. What kind of surgery was it?
Well, I had endometriosis, which took them a while to diagnose.
Mm-hmm.
And while they were diagnosing it, they just kept prescribing pain medication. And then I had to have an oophorectomy and then a total hysterectomy.
Got it.
And it snowballed.
Yeah. Endometriosis, I'm a retired gynecologist, okay? Endometriosis is incredibly painful. You know.
Yes, it is. I wouldn't wish it on anybody.
No. What did they put you on when they were treating the endometriosis?
Well, they started out with, hydrocodone, and then upped it to oxycodone, and would rotate between those mainly.
Got it. And then once you had surgery, was it the same oxycodone prescription?
Yeah, for a while, and then when they finally recovered from the hysterectomy, and there was no more endometriosis, and they cut everything off. I had been on it for so long at that point. It was awful.
Awful. One of my patients said it's dope sick.
Yeah, exactly.
Dope sick. So
it's exactly what it is.
So because you were addicted, you needed to get medication. And what happened? How did you get to medication?
Usually through a dealer or somebody selling their medication or medication they got from somebody else. So,
right. Were you working at that time?
For a little while, like on and off in between. It was a pretty long period. So,
you mean talk about years? You think?
Oh yeah, definitely years.
Years. Oh wow. Wow. Well, it doesn't take very much exposure to opioids for addiction to occur. We know that, and if you take a look at it, you'll go, oh my God, even if you take it for like 10 days, there's a risk of addiction. So it's scary. It's scary.
Oh, absolutely.
Right. So how long have you been on Suboxone now?
I have been on it for, oh Lord, probably about 10 years.
10 years. And you've been my patient for about that long, haven't you?
Yeah.
Good. Oh, good. And you have children.
I have 3.
3. That's wonderful. Congratulations. And how's your life now?
It is much, much better. I call it calm. When you're in addiction, everything is so chaotic and so wrapped up around your addiction and getting your drug and using your drug, and it's just chaos. And now none of that exists. It's just normal everyday life.
Did you break any laws or steal any medications or anything like that when you were searching for meds?
No, I never did. My ex did. And actually spent time in prison for that. But he he was an addict, a whole different type. He was addicted to cocaine,
Okay.
and it wasn't a good situation all around, basically.
I'm sorry. Where's your ex now?
Um, he has passed away from an overdose.
Oh, God Almighty! I'm so sorry, Kelly. My goodness. Uh, and I'm sure as bad as it was, I'm sure you still miss him. So
Oh, absolutely. It wasn't a situation where we didn't love each other. It was a situation where we just weren't good for each other.
got it, got it. And you had 3 children together.
Yep.
Now, if I'm not mistaken, you have one in college, you
Yes.
have one in high school,
Yep.
and where's the third?
The third one, she is married and living in Kannapolis.
Great. Okay. Grandchildren?
Not yet.
Not yet. That's wonderful. That's wonderful. Now, your conversion to Suboxone, was it difficult? Was it easy? Was it somewhere in between? What was it?
No, it was really easy. It was amazing how quickly I went from my body actually needing this substance to being able to take this medication and not craving the opioids as much, like, or at all, really. It just was a complete 180.
That's wonderful. That's wonderful. So I know that you are very active in the bands that your children were in, okay, and helping with the structure of the bands. Is that correct?
Yeah, I'm pretty active with the band boosters. I've done PTA stuff. I've done coaching youth sports. I've
That's
kind of done a little bit of all of it.
that's just terrific. That's just terrific. Kelly, what advice would you give to people on opioids? Would you tell them to convert to Suboxone? To what was it that made you convert to Suboxone?
My kids,
Your kids.
it just couldn't keep going the way it was going. Just going down that route was going to end up with very few options in the end. It was going to either end up with me dead in jail or in the hospital, basically. And that's not what I wanted for them. So I knew I had to do something.
Wow. So about 10 years ago, you made the conversion. Okay, to
Yep.
Suboxone. Good. And do you feel stable now?
Yeah, absolutely.
Okay. Your dose, does it ever change, or does it go up and down, or is it stable?
Just stable.
Stable. Okay. So one dose just does it all.
Exactly.
Cool. That is really wonderful. Well, Kelly, I'll tell you one thing. This has been a great conversation. I'm sorry about the loss of your husband. There's so many tragedies out there that you can't imagine. Okay?
Oh,
The stories that I hear every day are just unimaginable. And I want you to be brave and be courageous and live your life and raise your kids and get some grandbabies. And then you're going to be like Sherry and I, my wife and I, okay? We make lots of money babysitting our grandchildren.
yeah, hopefully one day, not hopefully anytime too soon. My kids are still pretty young.
Pretty young. Well, kids are different these days. I always say that my generation, I'm in my 70s, okay, we did everything in the same order. Everybody did it. We all went to school, we all got a job, we all got married, and we all made babies. Everybody did that. People don't do that anymore. Okay? Because
No,
they're smart. Maybe they're smarter than we were.
I don't know. I think it's a good thing. I
Okay.
think some people became parents because that was what was expected of them when they didn't need
Exactly.
to be parents.
Exactly. You're right.
And
You're
I
right.
think them having the choice of going, yeah, I don't want to go that route is a good thing.
Okay. Well, Kelly, thank you so much for joining in the interview. Okay. And I hope that we at least get one person to convert from opioids to Suboxone. I ain't making a nickel doing this, but this is God's work, Kelly. This is God's work.
Absolutely.
Okay. And this is what we have to do. We have to pay it forward. Kelly,
Absolutely.
anything else you want to tell me before you leave?
Nope, I think that's it. Just
God bless
if
you.
it's not Suboxone, do whatever you need to do to change direction. If you're out there on whatever it is, whether it's opioids or anything, reach out to somebody, get the help.
Get the help. Kelly, thank you so much now, and stay on the line right now. Okay?
All right, thank you.
Thank you.